it's not our physicians on the ground, but let's take care of the population themselves.
Pleasure and an honor to be on stage with you this morning to talk about AI and the use of AI in healthcare. So we've seen a lot, yesterday especially, the use of the word longevity and how much this is a buzzword as of now. But with AI, more than just a buzzword, we are actually going through a radical shift in history, where in healthcare, this is crucial not only to personalize treatment and improve diagnostics, but also and especially to really shift the paradigm from a reactive treatment-based approach to a preventative one that is focused on prevention rather than treatment. So with this focus in mind, my first question goes to all of you. And I would like to ask you, in your work, how is it that you've been using AI to personalize patient treatment with the aim of prevention? So, please, yes.
Okay. So I'll take a broader lens.
Yes.
Obviously, given the breadth of work that happens at Pure Health, I can give you a couple of examples, not only of how AI is advancing personalized care, but how it is improving the effectiveness and efficiency of the entire healthcare sector. So in the hospital setting, we are using AI to assist with radiology services. We are using automated sort of diabetes scanning with retinal scans. On the operational side, we're using AI for all kinds of things like improving and understanding patient wait times. In our stem cell research facility, we're using genomics and AI to understand pharmacovigilance, which is how will people react to what kind of pharmaceuticals. And then finally, with the Department of Health in Abu Dhabi, we have the mandate to provide the data and insights that the Department of Health has to other collaborators so that we can work on drug discovery, improve personalized medicine. So the work is very broad and very, very exciting.
Absolutely. Thank you, Rizwan.
Yeah, I'd like to echo that. I think in a hospital setting or a healthcare delivery system, you integrate things to help different processes. All processes, when they become more efficient, increase your capacity and access to care. So I think that's an easy win or a low-hanging fruit for implementing or integrating AI into process so you can do things more efficiently, lower cost, and then as a byproduct of that, be able to serve more patients. What we're doing, though, is similar to what we've heard here, is integrating that into diagnostics. A lot of the diagnostics, especially in genomics, are very different in this region. Most data sets use Western genomes in order to create paradigms. What we're doing is creating data sets that are relevant to our population, and we heard yesterday that about 30% of mutations could be missed if you don't use your own data sets because of a different population. So we're doing that, especially in oncology, where it's critical. We're also looking forward in trying to develop new algorithms in order to improve diagnostics or therapeutics in things like radiation oncology, for example, in order to do radiation therapy planning. Usually and conventionally, it'll take about a week to do that. Algorithms are being developed to decrease that time into days so you can get that patient treated more effectively sooner and hopefully with a better outcome.
Very nice. Thank you, Edward.
Thank you. I think it's difficult to add what the gentleman already explained, but I think I'll come up from the angle of, at the risk of tooting my own horn, I have got to follow two clear paths in my career. One is, of course, I'm a practicing physician, and the other dichotomy is that I'm a computer scientist. And the reason I mention it is important because for the last 20 years, I'm trying to combine these two together. And the dichotomy perhaps for your audience to understand is that medicine is a deduction and inferential science. It's a non-exact science. What I mean by that is you have two people with the same symptoms given the same treatment will respond differently.
Yeah.
We go to the other side of the table where computer science is conditional logic driven. Our colleagues will understand works on certain principles. When you try to meet them together, it's like having two magnets north pole to each other. They keep repelling each other.
Mm-hmm.
What AI has done in this context, especially from a preventive side, is provided that magnetic field that suddenly both start to gel together. Now, from a physician perspective, he has the power of looking at 150 plus different features all of a sudden, which we know contributes to disease development. He can predict the onset of diabetes decades before it happens. We worked on an algorithm which can predict the complication of diabetes and chronic conditions, again, decades before they emerge. And that itself led to a good quality, a better quality of life for the patient themselves, but on the provider or payer side saves immense amount of resources which otherwise would have gone into treatment. Famous, I think, figure that probably everyone knows, that every single $1 spent on preventive services saves $8 on the treatment side. So it's a massive, massive saving from a resource perspective for healthcare providers as well. So naturally, that's a very natural fit from our perspective. Mm-hmm. Two elements that we look into is workflow augmentation from AI application, which is whatever our physicians and clinicians were doing, how can they make it better, quicker, more efficient, and so on and so forth. And the second piece is risk stratification. Can we look at the population and stratify the risk of developing something down the line? And we know about it now. And not just know about it, but we know what element is actually going to cause it. So now we are in a position where AI can, from a personalized medicine perspective, can indicate that if 3 things need to be changed for this particular patient, which is possibly weight, possibly HbA1c, and another element, the risk of developing diabetes complication for this person can be further lowered down the line. So that is a godsend for our practitioners on the ground.
Yes, that is beautiful. Thank you for your insights. And this actually brings to my mind a current debate that is going on, which is that AI will eventually replace practitioners. And what I would like to say, but please share your insight as well on this, is that more than actually replacing practitioners, the role that AI will, or how that will develop, is that practitioners will be able, those practitioners that will be able to integrate AI in their work will be the ones that will be having much more success and much more of a way forward than those practitioners who won't. So I would like to actually direct my question to the public in this case. If there's someone that would like to share, what is your insight? What is your perspective on this aspect? Do you think that eventually down the line in 5, 10 years, 20 years? Yes, thank you. If you can bring a microphone. Maybe let us see if someone wants to speak. Thank you if you want to go on stage. That's amazing.
I don't think it's going to be replacing, but it's going to help enhancing. Currently, worldwide, I think there is a worldwide competition about providing proper number of healthcare providers from physicians, nurses, and I think applying AI will help to reduce the time, more efficient use of our staff, utilize them in the best way. It can do the initial screen and leave the difficult cases for the physician and the nurses, and it's going to make the life easier. It helps us to improve the service, reduce the medical error, make a standard that can be applied everywhere. I think it's going to make it different.
Absolutely. Thank you.
It's not going to replace a human. We still need a human touch and dealing, but you need massive screening for everything. And that can be done by technology.
Exactly. Thank you so much.
You know, I'd like to comment on this. You know, I'm a practicing neurologist, and I bridge the widespread use of MRI in medicine. And when MRI was introduced in the United States, I'm American, they felt that neurologists would be obsolete. Mm-hmm. And there was actually a movement to retrain practicing neurologists to become primary care physicians in the United States. And that hysteria went on for a few years. I think what we're going to find once we really augment AI into healthcare, into a clinician's tool set, it will still be practice of medicine. And the questions that we're going to have are going to be exponential. And the real challenge is going to be how to manage all those new questions that are coming out of these algorithms or AI algorithms and temper expectations. Because patients are going to expect that that AI algorithm is going to provide you with a diagnosis, a cure, not a therapy, a cure, within a very short period of time. And that's the real challenge. It's not adding the tool, but tempering those expectations.
Mm-hmm. Mm-hmm. Absolutely.
Yeah, I just want to add that on the ground, it's already very evident that the freely available tools, our physicians are a creative bunch, by the way. They work under pressures and they're a creative bunch. The way they are incorporating those tools in their workflows is amazing. And you start to very clearly see a differentiation between those who actively seek out and say which tool is best and developed and I can incorporate and I can take advantage of, and those who are still on the side and still thinking whether I'm going to dip my toe into or not. The efficiency is a big difference. A really interesting use case from one of the physicians I saw, which not something that I would endorse, is for him to write his medical notes by having 7 bullet points and translate it into a beautiful SOAP note, which then he just quickly reviews and then signs off. Otherwise, something would have taken him the entire evening to develop and everything, but he just does it. Not something, again, I would endorse, but it's a big difference on physicians and clinicians who are embracing it, with some supervision, with some human supervision, of course, and those who are still thinking, okay, whether this is safe or not safe, or how they adopt.
Absolutely.
So my thoughts on this are, I don't think the healthcare is the only sector where there are these, I would say, maybe overblown fears. I do a lot of work, or have done a lot of work in the education sector. I think we've been speaking for the last 25 years that technology will replace teachers. Last time I checked, my daughter's teacher was still a human being. So I think that those fears are overblown. I do completely agree. I think the practice changes drastically. And the teachers of tomorrow are the teachers, and the physicians of tomorrow are the ones who integrate and make their practice better.
Yes, absolutely. Thank you. Dr. Yazir, I would like to stop 1 second more with you and ask you, actually, always in the realm of predictive analysis, if there is something more that you would like to share of what generative AI brings to the table for practitioners.
So generative AI is a very interesting, of course, most recent phenomena. And the gist behind it, literally, that there's a high computing power which examines the patterns in the data and then can replicate it as an output of an image, of a text, or what have you, or even a model. So I've explained one of the use cases, the creative use cases that I saw. Again, I have observed our physicians and surgeons augmenting their note-taking process from that perspective. But I think the most creative one that I have seen is one of the physicians recording the conversation between them and the patient and showing me how he can feed the transcript to AI to turn it into a medical note, which I thought was amazing. I thought that was, like, how did he come up with this thought process? Though it was a proof of concept, but how he came up with the thought process. For preventive purposes, again, there are two sides to it. One is a practitioner side for the physicians. They start to have these insights from very complex models, which are affecting as well as informing their care on the ground. That is one element. Plus, I'm also seeing emergence of a slightly newer way of working where it's not our physicians on the ground, but let's take care of the population themselves, which we will take them through the entire population management algorithm, entire preventive algorithm, and identify those 20% of population which is at high risk, which if not intervene at this stage, will start to consume 80% of your resources. If I can develop that element, I can intervene early. I can not only save resources for a healthcare system, but of course improve life for that population as well. Like I was saying earlier, workflow augmentation is one element, but preventive element from a healthcare perspective is the huge science that we are progressing towards.
Amazing, thank you. Okay, my next question goes to you, Rizwan. And it's a bit different one and interesting. I would like to ask you what are the key considerations for AI in healthcare to be inclusive and representative of all genders, age groups, cultures?
Absolutely. So absolutely, you're right. That's a great question. And I think we should think about the question with three things. We should think about skills. We should think about data. We should think about algorithms. Mm-hmm. So we need to think about the skills gaps. We need to think about what we call data deficits and algorithmic bias. Algorithmic bias is very simple, so we can knock that off. I'm sure many of you might have seen that Marriott video where two people went and were trying the soap dispenser, one with a black skin tone, the other with a white skin tone, and because the devices had been designed for whiter skin tones, the gentleman with the black skin tone keeps, passing his hand underneath, nothing happens, right? And it was spread widely across, and there was a lot of conversation. That's an example where the device and the algorithm is trained on something. That bias needs to be corrected. The second is the data deficit. And you talked about the data deficit in one sense, about most of the data that is available is for audiences that are outside of this region. Right now, the healthcare data, we're talking about nearly 40 zettabytes. That's 40 billion terabytes of data. But most of that comes from Western systems. We need to overcome that data deficit to make sure that the data is representative, because that has implications on the algorithm as well. The third and the biggest is actually the skills gap, because we need to make sure not only do the computer scientists understand how AI works, et cetera, but we as consumers, physicians, need to understand what are the limitations. What is the algorithm telling me, and what are the limitations of where not to trust it? So as we develop a deeper appreciation, we all need to develop what I call data literacy, so that we understand where can we rely on the algorithm or AI and where we can't. I think part of the problem is we've jumped to AI, and if I can use a small mnemonic to just remind us, maybe we should start with the D. So DI, CI, BI, and then AI. So DI, in my mind, is data integrity. This CI is cultural integration, meaning data and evidence-based decision-making needs to be integrated into the culture of the organization. The third, BI, is business improvement. Using that business, broadly defined, it could be the business, it could be provision of healthcare services, BI, and only then get to AI. And we can't jump without actually making sure that the data is trustable and we believe in the integrity of the data to AI. And I think that one of the things is we just need to hold ourselves a little back and make sure that we've done all the prerequisites before we dive right into it.
Beautiful, thank you.
I want to just add on the bias piece that Rizwan mentioned. So with generational AI, what is happening is that the access to AI has been democratized. Now, you can go in and I can go in, and there are a number of large language models that I can have number of instructions set done, and then the model will behave the way I want it to behave. Earlier, the only option for me was to learn a programming language to write an instruction set to program a computer. Now I don't have to. I can literally dictate in my own language and say, write me a Python program, write me a C++ program, or it doesn't even have to do that. It will understand my instruction and do whatever it would do. But the interesting observations coming out is that biases that we see in large language models especially are actually the reflection of biases present in our society. Yeah, the models I've been trained on the petabytes of data that has been cured from internet and people's opinions and pharmacies and everything else. And at that point, there was no way for us to have a curated view of it. But now we have one place, then we would go and ask a question and you'll be shocked by the answer, because that's reflective of the collective wisdom that it has been curated from different models. And perhaps that's the start of realizing the problem that actually exists before we start to do something about it.
Yes. Dr. Edward, I would like to focus 1 second with you on the MENA region. And what do you think, according to your experience or to research, how does the MENA region fare with AI regulations? What are the opportunities as opposed to the challenges within the global ecosystem?
I think the opportunities are huge here. The regulations exist, especially in Saudi Arabia. Sadaya is clear on its rules and regulations, but the opportunity, because of what we've heard here, is huge. If we're looking at drug development using traditional systems that exist already, the Western genome, or all this data, has been fully interrogated. It's been fully interrogated. So industry is looking for other partners to have new curated data. And I love this comment that you made, because data needs to be curated for it to be used. It can't just be data existing in free sets. The curated data is very informative and powerful. And integrating this data into that platform in a curated fashion would accelerate global drug discovery. And the region is global. Disease is global. Things happen differently, but you'll have proportionately things happening differently. But once you find something in one population, the ripple effect goes global. So I think this is what the region has to offer. I think we talk a lot about data and data privacy, and these are real issues. I think the person that's not at the table in those discussions is the data owner. The data owner is the person that data came from. And that person really should be the owner and the decision maker of what happens with that data, their data. And I think globally this is an issue. It's very paternalistic, where governments in USA or Europe is very complicated now, because you have all these different countries and they're all having different rules and regulations, and harmonization needs to occur. And then the owner of the data needs to be at the table to sort of give their input and their thought process in order to move the dial forward. It's the only way we're going to have a successful future in this new paradigm.
Yes, absolutely. Thank you. So we have to wrap up our panel, but before we end, I would like to sort of sum up your contribution today and ask you the following question. To each one of you, let's say that you get to leave this world and you cannot leave anything here of your discoveries, your results, your patients' experiences, your teachings, but you get just to leave one sentence, one message, one piece of wisdom that you would like to share with the audience today. Which one would that be?
I'll start. I think I would start with just one sentence. We have been pursuing digital transformation in healthcare for a while, and all we achieved maximum was digitization. This is the single most intervention possible by AI is leading us so fast to digital transformation. We all have to be ready. We all have to embrace it.
Mm-hmm. Thank you.
Well, this is a very difficult question. I think the real message is to have happiness and peace of mind. If I'm leaving, that's what I would wish on everyone. I think with artificial intelligence, we have to embrace it. We have to embrace it and use it to its fullest potential. But we have to understand the limitations of the tool. It's a tool like any other tool. It's just different than a conventional screwdriver or stethoscope or whatever it is you want. We have to temper patients' expectations from it because they have high expectations, and the healthcare delivery system does not meet patient expectations. The gap is as big as that data set that we just heard about.
True.
Patients want restorative therapy without side effects, one-time exposure. That's what everybody wants. And I guess we have to understand the risks and mitigate them. So that would be my thoughts.
Thank you.
So my thoughts, I'll just pick up on what Yasser said. I think digital transformation, the promise was always there. I think we can dial up the promise. The promise is actually data-led transformation. And I think that on that, we need to be even more thoughtful, even more planful, because every small step has the risk of derailing it. Understanding the data, understanding culture, understanding and tempering expectations. So the promise is absolutely there. It just needs to be a very deliberate march towards that.
Thank you so much. Thank you, everyone. Kind of applause. Thank you so much.
Thank you very much.
Thank you.
Thank you.